put a big suture around the whole thing. Of course, it was a beagle, like a 17-pound beagle, so it's not like it was a big dog. If you have a defect in your body wall, you can close it with mesh. Say if you took a big tumor out here and it took the ribs, this is how you close that, or you can do a latissimus dorsi flap. Let's see, this is showing chest tube placement. We'll do this in lab in the spring. That'll freak y'all out. This is more chest tube stuff, and a continuous suction device. And they make these kits that you can put a hook on continuous suction. Usually, what we do here is just intermittent suction. These are if they have ongoing losses. This is if you have a diaphragmatic hernia right up against the rib. This is how you can close that around the rib. You can actually suture defects in the lung, a lung laceration. That's how you do that. This is showing you diaphragmatic roll-up. So if you had to take this part of the ribs out for a tumor, you could roll the diaphragm up. That's another flap you can use to close a big hole in the chest. I'm flying through these because I'm not going to test you long anyways. This is the guy who had the micro abscesses in his lungs. So, any questions? All right, real quick review. For your hepatobiliary, hold on, I gotta find it. Okay, concentrate on portosystemic shunt. Look at clinical signs that you see in dogs versus cats. Look at post-op complications, especially the big one that we worry about, which is portal hypertension. And preoperative management, how are you going to do medical management? And think about ammonia when you're looking at that. All right? Can I move on? So those are the 3 hepatobiliary questions. The rest are all on the respiratory part. So I think on Tuesday I pretty much really emphasized the lesions involved in brachiocephalic airway syndrome. There are 3. There are other conditions that are associated with it, but for brachiocephalic syndrome, there are 3. Okay? Make sure you know which are and which are not. When I talked about the soft palate, I talked about how far you should trim it. If you should trim too much, you get aspiration pneumonia. If you trim too little, you don't fix the problem. So where's kind of your key there? Where should you be cutting? I think it was yesterday, I talked about chest wall defects, rib fractures, and frail chest. And I used a special word called paradoxical motion. Make sure you know what that's associated with. Tracheal collapse. Look at that. I'm looking at the questions here. This is which statement is least accurate? I think you're going to be fine on that one. That's one of the ones that Dr. Martin's going to thump me on the head for being too easy, I think. Just look at it, okay? Just look at the topic. Know who's affected. Know which ones could be treated medically. Where each section tends to collapse, whether inspiration or expiration. And how we talked about treating it. There's a treatment here that I did not talk about. Chylothorax. Appropriate treatment for it. Your key there is going to be look at the diet. Because you got two divergent diets on the answers. 3 stages of laryngeal collapse. I kind of beat that into the ground. Y'all should know that. Starts with the everted laryngeal sacrals, right? Okay. You're in the clinics and a obese yellow Labrador retriever is coming in for vaccinations. What's your diagnosis? Okay, what is the fear when you use electrocardiogram or lasers in upper respiratory surgery? Or respiratory surgery in general, actually. Oh, I didn't tell y'all this one, so I better re-emphasize this. You know, when I was talking about pneumothoraxes, you could get a pneumothorax by hit by a car. We don't always have to treat those. Sometimes we watch them. If they're not being affected respiratory-wise, you see air in the chest on radiographs, but the dog's sitting there fine. He's not having problems breathing. He's nice and pink. We don't treat those. We watch them. Okay. I think that's enough said on that one. The topic I talked about today, pectus excavatum. Know what the abnormality is, okay? Don't get it confused with the other congenital problem, the peritoneopericardial, okay? And then an Afghan comes in on emergency, coughing and respiratory distress. What 2 diseases are you going to think of right away? And lung lobe torsion. There you go. Bonnie thanks you. Yes, his name is Bonnie. I thank you. If you have any questions, I'll entertain them. Okay. So no questions by the class. I request that when you guys go into the lab, okay, when you go into the lab, pay attention, make note of the condition, and not only the cleanliness, but the orderliness of the lab. When you look at the cages, take a really good deep look. Y'all been cleaning out the trays, but around the edges where the trays fit in, they found some nastiness, okay? They did stuff I'm not going to expect y'all to do. They pulled the cages away from the walls and swept and mopped behind there, and they pulled up the drains and flushed the drains. I'm not expecting you guys to do that, okay? But when you clean the cages, make sure you clean the cages thoroughly. Make sure you sweep and mop the floors, okay? Make sure things are neat and orderly and the tables are wiped off, okay? Don't leave dirty dishes in the sink, whether they be, trachea tubes or bowls. Wash them, dry them, but put them away. Yes?
Can we get like an email with like all the written things that we are responsible for?
Yeah, it's on Blackboard. There's a cleaning protocol that I was told to do by the dean when they put me in charge of the lab and the building. Of course, I didn't get a key to the building for 2 years. Master key. Okay? So, yeah, there's a cleaning protocol in there, but just take note, okay? Take note. Since y'all cleaned and Logan and Martha went down and cleaned, when y'all see them in lab, thank them, okay? And then Mr. Brownlee, DJ, Dr. Bellamy, Martha, Logan, and then eventually myself went down there yesterday evening, okay? Some of that I don't expect y'all to do. The deep cleaning, no. But your areas, cages, floors, tables, Yeah. I appreciate you guys. I think y'all are doing really well in the lab. I hope you're doing well in this class. I know it can be tough. I apologize, I don't have op reports graded. I have time today, hopefully I'll get them done today. I planned to do them the night before, and I had to do your test questions for this class. I was going to do them last night, and I was just too aggravated. By the time I got home and cooked dinner, it was 8:30, so I just chilled. So I apologize, but I will get them graded today. All right? Thank you.
Guys, one more announcement. For those of you who